Hi, I'm Dr. Spence Yarner from Joint Repair Clinic in Montana. Today we're going to talk about what we do in our office. There's so many different choices out there for joint pain, from physical therapy to drugs to surgery. We'd like to show you what we do here at Joint Repair Clinic in Montana that changes people's lives in a natural, healthy way. So we started Joint Repair Clinic of Montana because I was down in Texas and I was visiting doctor's offices for my son who went to college down in Texas. And I went into a chiropractor's office and he had before and after images of joints, knee joints and hip joints and shoulder joints where you could clearly see an improvement in the joint. And I was quite amazed when I looked at those images because being a chiropractor, I'd never seen joint cushioning or joint spaces improve. So I asked him what type of chiropractic he was doing that was getting results with joints like that. And the chiropractor just smiled at me and he said, "This isn't chiropractic, this is working with umbilical cord tissue." And when I saw that, it just changed my life because I realized we could do things for people's joints that I never knew about. I came back and I did research. And there's some great researchers out there. One of my mentors is Dr. Riordan. And once I learned about what umbilical cord tissue was capable of doing for joints, I just got excited. So then I said, I gotta find clinics in Montana that are using human umbilical cord tissue. And particularly, I was very interested in finding umbilical cord tissue from the highest labs. And one of the labs that we found that I believe had the highest quality was Dr. Neil Riordan's lab called Signature Biologics. And so after researching the different labs, and I actually traveled to the different labs, we understood that they had the highest quality product. So we started putting human umbilical cord tissue in people's joints to recushion the joints, and we have had great success then. And once I found that nobody else in Montana was using that tissue, I realized we needed to open clinics. So not just one clinic, we opened 4 clinics in Missoula, Helena, Billings, and here in Bozeman. The golden jewel of what we do to recushion joints is the human umbilical cord tissue that we put in people's joints. But there are other things that we can also do for people's joints, things that are less expensive, that are available options. In fact, we found if we put a combination together, we get the best results. So one of the things we combine with our human umbilical cord tissue, and we involve some specific chiropractic adjustments that if people have nerves that aren't functioning ideally to the joints, and since your nervous system runs everything in the body, your nerves also control blood flow. So if people have nerve damage to a joint, one of the first things we want to do is make sure that those nerves are functioning better to the joint so that when we put in the umbilical cord tissue, we get better results. Another thing that we provide is nutrition. We found that umbilical cord tissue has certain vitamins and nutrients that helps it thrive and helps it function better. And so we provide supplements and nutrition to give the results of our umbilical cord tissue a better chance of success. Another thing that we do is we work with PRP, which stands for platelet-rich plasma, where we actually draw people's blood out, we spin out their platelet-rich plasma, we add an accelerant to it that from plasma solutions that enhances the qualities of PRP, and then we inject that back into the joints, and that has anti-inflammatory components and growth factors, and also is a support to the umbilical cord tissue, but PRP by itself also has benefits. So you can do the PRP by itself, or you can add it later to the whole package to enhance the effects of the umbilical cord tissue that we work with. Another system that we work with is pulsed electromagnetic field tables, which help increase the blood supply to the joint area. It resets the nerves, and it also improves the functioning of the umbilical cord tissue, or the benefits of umbilical cord tissue. Another service that we make available to our patients is prolotherapy and ozone therapy. So what prolotherapy is and ozone therapy, basically prolotherapy is using ozone with some other products that also magnify the benefits, some different vitamins that increase the benefits of ozone by itself. But what is ozone? Ozone is O3, and oxygen in its normal state is O2. So by putting ozone into joints, many joints that are not healing, that are hurting, that aren't functioning right, are hypoxic, which means they lack oxygen. And when you put O3 or ozone in a joint, it wants to get rid of that extra oxygen. So when you put an extra oxygen in an environment that's lacking oxygen, that environment gladly takes that extra oxygen and uses that extra oxygen to help the joint. And so a lot of our patients have gotten lots of relief, and their quality of life improves a lot with just using ozone or prolotherapy. I want you to understand that when you go through joint replacement, they're sawing off live tissue. I mean, your bones have nerves and blood, and they're live. And they're replacing them with dead tissue, metal and plastic, and that's not live tissue, that's dead tissue. And so for people, there are people that are blessed with artificial limbs to improve their quality of life, but it wouldn't be my first choice. For instance, I always see on TV and I've met in person soldiers that come back from a wartime situation, they have a prosthetic leg. And I thank those people for serving, and my heart goes out to them and to their families. But I have never once in my life heard somebody say, when they look at a soldier with a whole artificial leg, that I wished I had an artificial leg. Everybody I know would always prefer to have their live tissue. It just amazes me that in the joint world, artificial limbs are accepted as a good option. Now, they may be a good option, but for me, that would be my last resort. Once you go down the road of replacing live tissue with an artificial limb or do joint replacement, you can never go back and undo that. And if I could only help you guys understand the thousands of people that I've talked to that had joint replacement that are not happy. Now, a lot of people, when they first get their joint replacement, they're happy or they seem to be doing good, but very often we don't hear from those people 5, 10, 15 years later, and a lot of those people at that point aren't doing so well. So a question you should ask yourself is, why don't orthopedic doctors or medical doctors often want to do joint replacement in younger people? I had my dad, who they wanted to replace his hip. They wanted him to wait until he got older. They said, you're too young to do joint replacement. Well, if joint replacement is a healthy thing for you, I would think they would want to do it sooner than later. But I believe the reason they want to wait is they realize that these joints aren't going to last forever, and so it's risky to put the joints in too young. Well, if it's risky to put them in there too young, I still think it's risky to do it when you're too old. The other thing that so many people don't realize is that I read a research article done by an orthopedic doctor that explained that within 1 month time, or the 30-day mortality rate for people post knee replacement surgery is 1 in 400, which means 1 in 400 people die within 30 days after having joint replacement. I actually didn't believe this. I found that too hard to believe, so I printed out the article. But then unfortunately, recently for me, I had a patient whose dad had knee replacement down in Arizona, I believe. And so he flew down from Montana to Arizona to take his dad to his appointments. And I believe he had his knee replaced on Thursday. My patient took him there Wednesday for the pre-op appointment, on Thursday for the surgery itself. And the patient was supposed to return home on Saturday. On Friday, the patient was going to go down to visit his dad at the hospital, and his dad said, don't come down. We'll be going home tomorrow. Just stay home for a day. And so my patient decided not to go visit his dad on Friday. Unfortunately, Saturday he had got a call that his dad had passed away from complications of the replacement surgery. So I just want you all to understand that anytime we do any surgery and anytime we do any medical procedure, including what we do, there's always risks. And so it's important that you look at the risk and make the right decision for you. So if any of this is hitting home with you or makes sense, or has at least got your interest, please reach out to us. We have clinics in Bozeman and Helena and Missoula and Billings. We also have a medical team that can answer questions for you. We have a lab that can answer questions for you. You can set up a one-on-one consultation with me over the phone or through Zoom or in person. We have a team that's here to make sure we give you the resources so you can make the best decision for you. But we just ask you to take some time and research this stuff, take the knowledge and apply it. And if you use knowledge I'm confident you'll make the right decision for you.